Hi everyone, I'm John from HTN and welcome to this webinar today where we're going to focus on workforce transformation. And I'm really pleased to welcome our panel to the session. So joining us, we have Dr. Penny Kayoglu, the CCIO and Deputy CMO at University Hospitals Coventry and Warwickshire, Stuart Juress, Digital Skills Manager at Greater Manchester Mental Health, Dan Chilcott, Clinical Client Enablement Director, not clinical, sorry, Client Enablement Director at Patchwork Health, and Sally Mole, Senior Digital Program Manager as part of the Digital Portfolio Group at the Dudley Group. So thank you to the panel for joining us. So over the course of the webinar, we are going to hear from our panel in terms of their work on digital and workforce transformation. We will discuss the key factors to success, the challenges around workforce transformation, and I'll ask how to overcome those challenges, how to drive buy-in and monitor progress. And then we'll move on to the role of workforce transformation in terms of the future direction of the NHS. And then we'll discuss how we can approach digital transformation in a more cost-effective way. So we've got quite a lot to cover over the next hour, but I'm also keen to hear from you in the audience as well. So if you have any questions, any comments, thoughts, or anything that you would like to share, please do so in the chat, and we'll keep an eye on those questions coming in as we go, and we'll answer them as we go, and we have some time for a planned Q&A towards the end of the session as well. And finally, this session is being recorded, and the HTN team will be doing a write-up, so you can read or watch it back at a later date. So let's get started. I think a good place to start is with some wider introductions. If I can ask the panel to share their role, remit, organisation, and a bit about their current work in terms of workforce transformation. So Penny, could I start with you for that question, please?
Thank you very much, and welcome everybody. I'm Penny Kayoglu. I'm a consultant clinical oncologist by background at UHCW and also the CCIO and one of the deputy CMOs. And I would say that over the last 4 years, we have gone through our EPR journey. We have gone live with this for the last 8 months now. And I think one of the biggest assets for us during this program and moving forward is the development of our workforce. And I think that webinar today comes at the right time because for me, digital transformation needs to align with the workforce and workforce development and building capacity, which is what we have tried to do throughout our EPR implementation. So we have built what we call a clinical informatics team, and I have given several talks around this, which is about building capability and capacity within the organization to not just go live with a technical system, but also optimize system, thinking how we can automate our workflow, how we can embed the patient portal, how we can engage with our citizens and patients better, which is all the projects that we have been doing. And without the workforce talent and enabling the workforce to be, I guess, trained on digital skills and also on the more specifics of how do we implement change, all those innovations would never have happened. So we need to continuously think how we can, I guess, evolve our workforce to enable that digital transformation to happen in organizations and healthcare systems.
Fantastic. Thank you, Penny. And Sally, can I come to you next, please, in terms of a wider introduction and the work in your organisation around workforce transformation?
Yeah, thank you. So I'm Sally Mole. I'm the Digital Programme Manager for the Dudley Group. I actually head up the PMO, so the Project Management Office for the Digital Portfolio Delivery team within the IT team. I also represent the Clinical Safety Board at the ICB level. My background is in pharmacy, so I've got extensive years of experience in pharmacy across community and hospital, and I took a sidestep into the digital world about 7 to 8 years ago, and I've been at Dudley ever since 2017. So I took a role as part of the clinical configuration team. I then worked my way into a project management role, and I'm actually the program manager today. So leading the PMO, I'm responsible for the delivery of the digital portfolio. So at the moment, we've got about 62, 61, because I've delivered a project today. So projects in flight, 34 of them are active, and that means that they're in flight and that they're being delivered, and then 18 inactive at the moment, which means they're either approved waiting for delivery, or they're waiting for resource. Looking at the workforce piece, so just to give people an idea of my background and what's happened. So when I started at Dudley in 2022, in my current programme manager role, there was no PMO. So we've created the PMO from scratch. It was one of my clear objectives when I very first started in this role, alongside the digital portfolio director, who was also new at the time. So lots of new changes and a whole new process to implement, and a whole new team to onboard. So we went from 2 project managers at the point when I very first came into this post, and now we've had in excess of up to 20 in this year, 20 team members across the portfolio team, some temporary, some substantive. So like we've done a lot in terms of transformation, of trying to onboard those team members and embed processes and governance. And then really trying to embed that into the engagement with the organisation and how we deliver our portfolio. So yeah, lots and lots of activity. I'll go into a bit more detail in some of the questions in a bit, but that's kind of the baseline.
Fantastic. Thank you, Sally. And Dan, can I come to you next, please?
Yeah, thanks, John. So yeah, afternoon, everyone. My name is Dan Chilcott. So I'm here representing Patchwork Health, and my capacity here at Patchwork is the Client Enablement Director, which is a bit of a sort of like a catch-all job title, because essentially I pull on a lot of my sort of like past experience where I was working in the NHS as a sort of like a workforce leader. Worked in numerous organisations like up and down the country, hence why I've got a bit of a sort of like peculiar accent, because I keep picking up the odd bit of Scouse and Manc every now and again, mixed in with like my southern accent as well. But essentially I support sort of like all aspects of Patchwork for the sort of like the onboarding of our new customers, as well as like the ongoing development within sort of like our technology suite as well. And our technology suite is predominantly focused on providing sort of the tools to help organisations deliver workforce transformation projects. So these sort of like start through some of like our early products where we were providing temporary staffing solutions to really help replace the reliance on agency, and then more recently sort of like focusing on sort of like rostering products as well. And then with like our recent acquisition of L2P and the job planning side, bringing together sort of like the initial sort of job planning stage through to rostering, to create sort of like a seamless journey of sort of like workforce delivery. And those projects are helping sort of like organisations like up and down the country as well. So as this conversation sort of continues, we can sort of share some of the things that we're doing with our customers. I'm really interested to hear what my colleagues here are sort of like working on sort of like in their organisations as well.
Great, thank you, Dan. And finally, Stuart, can I come to you for a wider introduction, please?
Yes, of course. Good morning, everybody. My name's Stuart Duress. I'm from Greater Manchester Mental Health, and my current title is Digital Skills Development Manager. A bit of history about myself. I am Health Records and Patient Pathway Processes by Foundation. That's where I started 25 years ago, and I've followed these pathways in my roles. So I've led in outpatients, inpatients, elective and non-elective projects with paper. I've followed the transformation from paper into electronic, to EPRs, clinical systems, clinical applications that replace paper processes, and I've trained and led on projects throughout my career. And now within my current role, I was brought in to start the electronic prescribing process using a gamification type of training, which is all workforce related. My roles, I make sure that I support the frontline staff with everything that they do, both on paper and now and in a digital sense, in a training platforms or clinical systems. The workforce is at the forefront of my priority. And with my current role, we are releasing a digital skills self-assessment, which assesses all staff's general ability across Microsoft products, but we're also starting to assess their abilities and their levels across the clinical EPRs, just to give us a gauge of where we stand, and then provide the necessary training based on the gaps that are identified. And it's a really intense piece of work with, you don't know what you're going to get from the responses, but it's so interesting to see where we stand as a trust. And it gives us that great foundation to progress for the future, knowing where our gaps are. And I think you'll hear me say digital skills gaps quite a few times through this meeting. But yeah, thank you.
Fantastic. Thank you, Stuart. Right, let's start with some questions. I've got 5 or 6 to pose to the panel, and if you have any in the audience, type them into the chat and we'll keep an eye on those as we go. So the first question from me is quite an open one around key factors to success. So Penny, could I come to you for this one, please? What are some of those key factors to successful workforce transformation from what you have seen?
Yes, thank you. I think for me is having primarily a strong vision. If we are continuously improving and innovating in healthcare as we do nowadays, especially as part of digital transformation, then our workforce need to move in a similar pace. But often we see that workforce capacity building falls behind and we move really fast without really thinking about how the workforce is going to keep up with all the changes. So for me, it's about thinking about the creation of new roles, thinking about training and building capacity in existing roles. It's about learning from others. So what other organizations and systems have done, learning from industry and other providers, and building not just the technical skills, but also the soft skills, which is about the management of change, which is about transforming and challenging the status quo and improving. So this is true not just for clinical staff like myself, but also for administrative staff, for operational as well as technical. And the other point is, how do we think about using technology to support staff and support workforce transformation? And for example, we have used AI to streamline routine tasks for our human resource staff, like answering calls, responding to queries around pension and stuff. And the same with our patients and our citizens. How can we ensure that, we don't use highly skilled staff to actually do mundane tasks, and we can use technology like AI to actually respond to those tasks so that we can ensure our workforce works at the top of the scope of practice.
Excellent. Thank you, Penny. And Stuart, can I come to you with the same question, but from a workforce skills development perspective? What are some of the key factors?
The key factors from my point of view is the context that's used to transform the staff. The staff are specialised in their current roles. They are used to using certain processes, they're used to using certain systems, etc. If you want to transform them in a digital sense, you must always keep the engagement contextual to what they're learning, where they want to get to, what they're going to get out of it, the impact assessment, the benefit realization. All right, we're not at realization stage, but they need to see a clear vision of what that realization will be, what the goal will be, because the most questions you'll get, the key factors are why are we doing it? Why are you getting in the way of my current practices to change a system that works perfectly well? They feel it works perfectly well, but you, as a digital transformation team, will have an understanding of what the chances are, the positive side of the change is. So that's the way that it needs to be reflected to the staff, is in a contextual way that they'll understand and in a way that they'll see the benefits that they're aiming for.
Thanks, Stuart. And Sally, from your perspective, in terms of key factors, what have you seen?
Yeah, I think I agree with the message, and obviously making sure that the value is outlined. I think there's a real, for me, the probably biggest factor in resistance to change is around the communication. It's about clearly communicating it to the organisation about why we're making these changes. And really like sending the message of how we're going to do it. I think a lot of like the resistance to change is can be quite daunting, especially if it's something that is a big transformational change. Kind of like, how are we going to do that, and how are we going to take people on the journey in order to be able to get to the end point? Sometimes that seems like such a long way away that you do get a lot of resistance and skepticism, I suppose, around the project and about the changes that you're trying to implement. So I think there is something about the communication, and obviously adapting your communication style depending on who you're talking to, because you're talking to lots of people at different levels. So you need to have lots of different formats of that communication. And then I do think there is something around the skills gap. I think, so we at Dudley, we baseline all of our staff against the SFIA framework, skills framework for information age. And it is a really good framework for us to kind of pinpoint, I suppose, current skill profiles, but also we're looking to kind of identify like what skill sets people have got that we're not really utilising. Bit like Penny said, like, you know, we know where we need to move to, and obviously we've got AI, we've got automation, we've got robotics, and do we have the skill set in-house to be able to do these things and transform the workforce, and implement some of these digital solutions effectively with the right staff? So I think there's something about that, and obviously as part of that, there is the engagement piece. I'd probably say that's probably the key factor really for the transformation. It's about really understanding people, understanding what their concerns are about the changes, and alleviating those concerns. And sometimes that might identify risks, and that's okay. You know, we'll talk about the risks, we'll talk about mitigating the risks, and we'll talk about what that means for that person. But I think the engagement with the clinical teams on the ground floor, and the engagement with our own team around the expectation about what's coming, and why we're doing these changes, and how we're going to develop, and what the outcome of that is, and if that is that it aligns to the strategy, and it's something that strategically we need to move forward with together. It's just really about giving that clear communication, and then really engaging with them around their concerns and taking them on the journey.
Great points. Thanks, Sally. And Dan, can I come to you from your perspective?
Yeah, absolutely. And everything that everyone said, it rings absolutely true, because like whenever we sort of start working with a new customer, like these are absolutely the things that we sort of like want to address. Is like, what is that vision? What are the skill gaps? What is like the like actual output that we're trying to achieve? You need to know all of these things. And actually, I think sort of delivering like successful workforce transformation absolutely does go back to sort of like really understanding the problems that all the different layers and different stakeholders are going to have, because the problem that your finance director might have versus what the actual sort of like doctor or nurse sort of viewing their shifts are going to have might be different, but there is commonality sort of between that as well. So it's making sure that whenever we look at workforce transformation, we understand that this is going to be touching lots of different people's radars in some different way, and making sure you're bringing a full range of their voices to the table, so you can make some really, really key decisions along the way, because no one likes having change forced upon them. But actually, when they know that there is a solution or like a problem that's going to be resolved at the end of it, they're much more willing to sort of be on part of that change journey with you, because this is ultimately what it's about. Is you're trying to do sort of like a really big project across an organization of potentially thousands of people. Like, there's no sort of like small feat to be undertaken. So yeah, really, really work with everybody. And I think the other thing that works really, really well for us is knowing sort of what those starting points, targets and baselines need to be as well, because again, you can then use data to really, really drive and evidence the success of a project as well.
Excellent. Thank you, Dan. And just before we move on to buy-in, comms, engagement, and digging deeper into some of the methods, I'd like to just talk about challenges. And what are some of the challenges that you face in terms of workforce transformation, and as well, how do you overcome them? Can I start with you for that question, please, Penny?
Yeah, surely. We touched upon a few challenges in the previous question, but for me, there are 4 challenges. First challenge is basically the change itself. I think that for some people it's daunting, and I think we mentioned that. And it's about giving people the autonomy for me and the permission to own that change. And actually, the fear of failure is very strong in the NHS, and for me, it's important to allow teams to fail and retry, because that's what leads to success. But we have to be mindful that staff could burn out in the process. So we need to be mindful of health and well-being during change. The challenge number 2 for me is the potential risk or perception that we're going to take staff away from clinical duties, for example. And I think that's really important to work within the context, which I think Stuart mentioned. So job planning, if we talk about clinicians or working as a team to understand whose duties are what and who is here doing what every day, is very, very important to make sure that people have the capacity to actually devote time to innovation and change. The number 3 challenge is the lack of trust if we talk about technology, and if we use technology to replace routine tasks. I think it is about increasing the confidence of the staff to use digital means, and that needs obviously digital clinical safety teams and all the clinical informatics that I've talked about at the beginning, and to support this. And finally, for me, it's digital literacy. And again, if we are going to use technology to take away mundane tasks for the workforce, then we need to expose staff to design methodologies, make sure that they, again, are exposed to digital and training to ensure they are able to use the technology to perform their duties.
Thank you, Penny. And Dan, can I come to you next in terms of challenges and how to overcome them?
I was going to say it's a really, really interesting one, because every organisation is different. And when we're working with sort of like numerous NHS organisations around the country, no one's the same. Like, there's obviously similarities, but everyone's at a different stage of like their digital journey. And we sometimes find, especially when sort of implementing like workforce management solutions, there's requirement to like integrate with like other systems that already exist, and sometimes like those legacy sort of like system integrations can become sort of quite a challenge, because obviously in order to integrate, that does require other systems and other providers to be ready and willing to do that as well. And that we sometimes do find that there is a lack, but obviously that we're dedicated to always trying to sort of like build out integrations and make things interoperable, because that flow and that sort of like minimizing like the duplication of like data entry when using technology is really, really important. So that's obviously like a challenge that we do need to sort of like try and overcome like really early on, so we can put development work in place to sort of meet those needs as well. And then I think financial constraints also becomes like a bit of a challenge as well, especially when people are replacing a sort of like a paper-based system instead, and there's no existing sort of like line on someone's budget statement for technology. Being able to sort of prove what the sort of return on investment is going to be from digitizing things, it can be quite challenging. But actually, when you start to drill out sort of like the efficiencies which can come from using these software and looking at what can be displaced, these things are possible. But again, it's some of those pieces which tend to be sort of like big challenges that we try and overcome sort of like with our sort of customers sort of like quite early on, so we can then embark on like the more sort of like resistance to change that sort of like Penny sort of like mentioned earlier on. It's like it's really important to actually sort of make sure that we sort of like bring people on that journey as well.
Excellent, thank you, Dan. And Sally, can I come to you next? Because we've spoken about integration, lots of different systems, and you started to say you've got 40 projects on that you're juggling at the moment. So I think it's a good chance to come to you.
Yeah, I think I'd probably say like there's a lot of challenge around, I suppose, like communicating out what it is that the solutions or what the change is going to be. And quite often, I think like the biggest lesson learned, I probably would say, from starting the PMO to now, is around that communication method and around actually setting expectation really for not just what the digital solution or the change is going to bring, but also what's the clear process that's going to get us through this delivery. I think taking people on the journey and understanding the baseline of their current solution, or whether that's paper-based, whether that's another digital solution, is the only way you can really outline the impact of the change. And then you can only really understand what that, where those risks and concerns and the kind of resistance to change can come from, by kind of going through that journey and that conversation with them. So we have lots of processes in place now, but some of the key documents that we've got is we've got a portfolio delivery checklist, which standardizes the way that we deliver our projects from end to end for every project that's delivered. We've also got terms of reference for product owners. So if a request comes through for a digital solution, or it might be a national request, we have to have clinical buy-in from the top down. We have to have a product owner, and we've got clear terms of reference about what their role is around engagement, and making sure that we have got the correct subject matter experts involved, so that when we come to doing things like clinical safety, that actually we've followed the right governance process, and we can say that we've got the right people involved, and that at the end, when we sign it off, we've done the due diligence. I think it is important for us to not only understand what solutions offer, but what the users need. Quite often you'll find there's lots of functionality within a system, but actually when we do all the current state process mapping, we realise that there's lots and lots of problems that we could also solve as part of this transformation piece. And there are opportunities for us to improve the services. So it's not just like for like, let's just change one process and implement that digitally. And then I think one thing I would say that I think is becoming more apparent as we make more things digital is that sometimes digital is a challenge itself. Having lots of legacy systems and us trying to do this information sharing far and wide, and trying to have shared services across the ICB and private primary care and secondary care can be really hard when you've got, so I think we've got in excess of 350 systems across the trust. Lots of information in silo. So I think sometimes digital can be a challenge in itself.
Thank you, Sally. And can we move on to how to gain buy-in, and any methods or methodology that you found that's worked? And can I come to you, Stuart, for this one, in terms of how do you best drive buy-in, and what have you seen that works to do that? Can I come to you for that one, Stuart?
Yeah, sorry, John. I thought you did. You went off for a second. I do apologise.
I did.
Okay.
Sorry.
Yeah. So with this question, obviously, you just need to be honest with the staff. Keep your integrity, and keep the human touch when engaging. Don't do everything via email or by SharePoint sites. Communicate on a human level with the clear illustrations of the goal. So, and that's to all levels, and it doesn't matter which platform either, whether it's a group seminar with hundreds of people or one-to-one. Keep the message the same, simple, but obviously with enough detail for them to understand what it is you're trying to achieve. And it comes from strong leadership. That obviously, the engagement practices, the plans put together by the transformation teams, keeping the service leads involved at all times, so that they can cascade and disseminate the information in the same way, and you get a communication trail that's flowing there. And if it's in writing, it just backs up the human touch. But I think, obviously I didn't get a chance with the challenge, but some of the challenges that you face is people saying it'll never work because we're not told in the right way, we're not shown in the right way, we're not provided the right training, etc. This is all down to the leadership of the project. The transformation is to what's on offer for the staff in the background as well. And I think that's a big message, is the communication. It goes on from what Sally was saying, as a big thing, communication is key. And the methods that you use is even more important. It helps to empower the people, if you've got a good methodology like this, because they feel important and they feel like what they do is important to be shown in a human level. So yeah, I'm going to put my efforts into making this change work in a theoretical sense. Not everybody has that mentality, but if you do up the communication, you go in a good length to make it happen.
Thank you, Stuart. Quick question, just on, you mentioned gamification in your introduction. What did you do then? How did that go?
It was a challenge to introduce electronic prescribing to a trust that uses paper, and I know and there's a lot of trusts out there that are still going through that journey because of the safety aspect of it. Not only were GMMH introducing electronic prescribing, but they were also introducing a new training methodology called Attenzi Training, which is the company that provides the platform for gamification. And what it is not like your tick box e-learning. So you go through a number of slides and it's not very interactive. You get a question asked at the end, of knowledge giving, and you get it right or wrong. However, gamification is a game and a test all the way through. And you use process steps like you are using the system in real life. But you answer the questions as you're going. So the game actually tests you on where you would go next, what you would click on next. And then it's sort of a bit more visual. And because it's a real life simulation, you meet characters. You can meet patients, service users, or even other members of staff, depending on what their training is. We've siloed it just for EPMA at the moment, but the opportunities for this type of training for behavioural side of it, so workforce transformation, transforming the way that people think about change, using a character, it's got endless opportunities. So yeah, we're quite happy with the way ours the outcome was. It was a very ambitious project, should I say, but it has succeeded in training our whole clinical workforce in electronic prescribing on an inpatient level. So yeah, it's gamification. Any more questions about that, feel free to email me separately.
Great, thanks, Stuart. Dan, do you want to come in?
Yeah, I was just going to say, I wanted to sort of build on sort of Stuart's point there around sort of ongoing communication. And I know that sort of Sally, you've mentioned this sort of quite a bit as well, because communication is absolutely vital, and it's the key to sort of getting that sort of buy-in right, and it's doing it at the right time as well. And I guess when an organization is procuring a piece of technology, there is going to be sort of a procurement process run where there are going to be sort of certain people on that panel sort of making decisions around the procurement of that. But there's also going to be potentially thousands of users that were not on that panel that you still need to sort of take along the right journey. So and actually this is something that happened to one of my colleagues just a couple of days ago, where essentially we're about to sort of embark on implementing on our temporary staffing software into an organisation, and the organisation wanted to have an open forum for all of their clinicians to sort of join that, so they could ask questions and be shown the platform. Quite a simple request for us to do, and our approach to that was, before we just sort of said, "Hi everyone, this is what our product does," we just had an open conversation where we asked people to identify what are the problems that you're currently facing at the moment, and what can you not do with your current paper-based process. And one question was just oh, I get sent a list of open shifts every single week, and it goes backwards and forwards, and it's impossible to work out what's still available, what's not. And you then understand the problem. So as you're then sort of demonstrating the product, you can be well, actually, this is how our product is going to solve that problem that you've got. And I think as long as people can relate to how this technology or how any sort of system is going to help them personally, that's going to sort of really drive that buy-in. So you need to be asking the questions around why could change help them, to then understand how you can deliver that. And then sort of building from that as well is knowing, especially for us as as a tech company, we're constantly evolving our capabilities and our product, and we do that through that constant sort of feedback loop as well, especially with workforce as well, because workforce is an evolving, changing concept that is constantly sort of being transformed and modernized. So we work really closely sort of in small groups to sort of make sure that we can iterate on the functionality we have have and really sort of deliver ongoing improvements to that product in a way that people continue to be bought into it as well. And we do that through webinars, we do that through user groups, we go and run workshops on site. And again, it's continuing that conversation. So after the project's been sort of signed, sealed, delivered, is actually the relationship continues in a real sort of continuous way as well. And that's how you drive that continuous engagement as well.
Thank you, Dan. And Penny, is there anything that you would like to add in terms of driving buy-in and methods that you found worked from your programs?
Yeah, I think a couple of things resonated with me when Stuart and Daniel were talking. And the first one is the fact that engagement doesn't come with one size. One size does not fit all. And we need to be able to use different methodologies to give the same message. And the second aspect is as Daniel said, that this is continuous. Engagement is not just a one-off activity. It's really important, and leadership plays a key role here at every level, is to actually continuously talk about the goal and how do we get there, where we are, how can we support each other. So engagement is ongoing, and I found in my experience it's best that engagements are incorporated within existing structures and frameworks rather than creating new meetings or taking people away from existing meetings and add more workload. Is how do we embed that message and the communication within our existing governance framework. So a couple of examples that worked for us as an organization is regular workshops, is blending the organizational staff with, let's say, industry staff to get that different perspectives and that integration. Is also the regular team check-in, a focus on problems as well as solutions and how we can use tech to actually solve real problems. And finally, think about local academic institutions, universities, and how we can use their expertise and research over the years to actually make change sense to the people on the front line.
Thank you, Penny. And we've had a question come into the chat. So the question is, can I ask about how you are ensuring sustainability, which is a really interesting point. And Stuart, can I come to you for this question? So the question goes on to say funding is one-off, that process, systems and change ends up in somebody's lap just to take on, and it can add additional tasks to the workforce. So how, from your role, are you ensuring sustainability in workforce transformation?
I mean, from my role, I am pretty much on the receiving end in some ways of the digital transformations that come in. And we, in systems team, we do obviously deal with a lot of project managers who implement major changes, with real impact on the productivity of the teams, etc. And there's no doubt that the impact is going to be realized. However, the BAU, business as usual teams that run everything moving forward sometimes end up on the back end of it, because the money dries up from the initial project rollout. The staffing that was supposed to be following, the project, or the actual assessment of how many staff would be needed to continue the change, to sustain the change and make sure it works forever, not just for the first few months after they realize the benefits, get their results. Everyone's, praising the achievement. But then 6-7 months down the line, unfortunately, it falls flat and becomes a real contentious issue for the teams that have to deal with it. So I think it's important from a corporate level point of view that the sustainability is the main aspect of the project to look at moving forward. We know the way the NHS works. We know how number crunching and money saving and is key. So it's important that at these times where there is money for digital transformation, it is used very, very, to the detail, in a longevity kind of sense. And it's important that the BAU staff even in the clinical sense, and frontline staff are all involved in the decision making of how this is going to keep performing for a long space of time, not just for the intermittent future. So.
Thanks, Stuart. And Sally, can I come to you next, please? Picking up on the point of overcoming financial challenges, and how can we approach workforce transformation in a cost-effective way?
Yeah, I think obviously the kind of starters and levers process needs to cover off as well, doesn't it? Like the changes that are being made. So I suppose there's an element of what do we do with new starters, what do we do with levers, and how do we have that consistency and like sustainability across the services as we're going through, and how do we support that as part of the handover? So we do a lot of handover within our projects too. We've got a BAU, so a service desk, and as part of that we do a HOTS document, which obviously looks at kind of issues that might come up and what they might identify, what are the SLAs, who are the support contracts with. And then the other thing that we're looking at is obviously like scalability and shared services. Like we should be looking at really like procuring solutions across the ICB level to get like better contracts, better procurement prices across the shared services, because quite often what you find is that the interoperability piece or the integration piece just takes a long time and takes money and takes resource. And if you can buy something where those services are already shared and you are rolling out just on a much wider scale, it just is much more financially sustainable. And also, I think like from the digital perspective around the integration of the services, it just works better because you're buying a solution that's intended to have services across border or across primary and secondary care, and they're developed in that way to work like that, instead of trying to fudge something and share data across systems that are completely different and sporadic, and you're just sharing like PDFs or like isolated pieces of data. So that does help.
Fantastic. Thank you, Sally. And Dan, from your perspective, leading on from what Sally's discussed around working on a wider scale, perhaps across region, have you any examples that you could share around that? And also, how do you think we could overcome financial challenges and approach this in a cost-effective way?
Yeah, I was gonna say it's quite awkward me sort of sitting here as a supplier, sort of being the one sort of like asking for the money. But I think it's the importance around sort of the products that we are developing are to enable organizations to get a return on investment. So whenever we sort of support customers with sort of like writing their business cases or sort of putting these projects together, is we're always looking around sort of like by having this, what are you going to sort of like gain and save? And this is like absolutely true. Like I think over the past 7 years, like we've saved the NHS essentially sort of millions and millions of pounds in agency avoidance by enabling these systems to run. When we're looking at workforce systems, we can't necessarily sort of prevent the need for sort of temporary staffing to be made, but the way in which that process is managed, we can absolutely help control. So we have like rate control management in our system. So essentially we look at historic data to sort of say, actually, historically, you're paying like these kind of rates, and actually with a controlled system in place, you could achieve this. Therefore, there's like a cost avoidance, or there is some return investment there as well. So whenever we sort of like work through sort of like our contracts and sort of commitments with customers, is we're absolutely sort of documenting what that is. So that means that when sort of contracts do come to an end, they've got that baseline information to know that actually, are they going to be able to sort of like procure again in the future? And if that was to be removed, what the consequence of that would be as well. And we're just like absolutely dedicated to constantly sort of like driving those workforce costs down where possible, while still maintaining sort of that organisations are delivering sort of like safe and effective care to their patients.
Fantastic. Thank you, Dan. And Penny, can I come to you next, please? How do we approach this in a cost-effective way? And then can we move on to how do we monitor progress around workforce transformation, and how are you perhaps doing that? So 2 parts to that question.
Yeah, I think everybody said a lot of things, and I would support very much. How do we leverage big transformation programs to ensure our maintenance training for our staff is right? Because I think Stuart is right. You get a number of agency staff, and when they leave, you realize that you've got a gap, that you used to have those members of staff as part of your program, and when the program ends, then you're left with a couple of people to deal with a big change. So how do we ensure that the maintenance training for our existing staff is ongoing? And how is the training delivered? Because that we have to use smart ways to train people and keep up with the training. And there are lots of online courses that we can use as well. And the other aspect is how do we use technology to enhance productivity? And I think Daniel touched upon that about the fact that we are deploying new technologies. What is the ROI? What is the outcome in terms of saving time for our staff to improve productivity? So I think that's a couple of ways I have found in our programs that work.
Thank you, Benny. And Sally, do you want to jump in, Sally?
Yeah, I was only going to say, just so on that financial aspect, the other thing that we've also been doing is, I suppose, like we're the NHS, we're a huge organisation and we've got lots of knowledge and lots of obviously transformation. We're doing a lot of lessons learned and a lot of sharing of our, not only sharing like the projects that we're doing and the roadmaps that we're doing, but we've actually shared our build for the maternity department with Bolton. So we spent nearly 2 years doing the maternity build, and they've been able to implement that within like a 4-month period. So I think there is something there about like having a look at the canvas in the area and where we've got the same demographics and we've got the same standardized builds or same EPRs, like actually sharing the digital innovations that we're doing. Because I do think in the NHS we tend to just reinvent the wheel all the time, and a lot of it is because there's information in silo, or it's people don't know what the other trusts are working on. So I think like sharing that information and sharing your roadmaps, in doing those things, we can also be sharing pooled resources, and we can share innovations and share like legacy. I think like Stuart was saying, like EPMA, like we went live with that in 2018. Like there are things that people have already done, and like you can take that and some of the learning as well that we've done as part of the innovation.
Absolutely, definitely. And Stuart, do you want to go in next?
Yeah, I think when it comes to finance questions, I think this is the main bulk of all our worries within the NHS. You've got so many goals and aspirations, money always gets in the way. But I think from a learning point of view, as Sally was just mentioning there, we've already got an excellent workforce, with very high level of skills, especially in system infrastructure, like to develop changes. And I think it's important to focus on the upskilling of those in a proactive sense rather than just on demand. If we are already skilled enough to deal with the changes within our digital teams, it will save money for the projects as a whole, and subsequently for saving money for the trust. We've got full apprenticeship levies that are, consistently underspent, whereas they offer so many courses on data, digital, AI even now. And we should be proactively looking to make use of these apprenticeship levies, because we just lose them in April all the time. And this will promote the self-learning of staff. And I think that's where we want to be. And I'm jumping a few questions ahead, but where we want to be in the future is promoting the self-learning within our staffs with the use of HR and workforce teams, is to make our staff think in a digital way. So that's part of their objective, to upskill themselves, and we also give them the tools to do it within our capabilities. But all these things are always on demand, and we're scrabbling around to support it in both a project sense and a BAU sense. Like, why not think in advance now? So
fantastic, thank you, Stuart. And Sally, coming back to you.
Yeah, no, just on that, I was only going to add, Daniel's going to shoot me probably, but we actually did some analysis on how much it costs a project team in the NHS to deliver the digital solutions. And on average, so we deliver about 20 a year, and on average, it's about 35,000, which is obviously like hugely less than if you went out to procure things. So yeah, I think there is something about growing your own and making sure that we've got the in-house skills and upskilling the talent that is already there, because I think that's the other thing, is we're not saying that the skill set is low. The skill set is really high. We just need to move with the times, and there is something about investing in your own staff.
I think that's a really, really good point. I'm not going to shoot in the foot at all, because it's one of those things. And again, as you work with like numerous organisations at different stages, some people have got resource available to them. So actually, can you tap into that sort of like support the delivery of the project? But then also, if you're a smaller sort of like mental health organisation that maybe hasn't got that same sort of like skill set, then it's making sure that as a supplier we can scale sort of like what our implementation models look like to do what's right. And I think that's like really important, again, is sort of making sure that if you are procuring sort of like systems, especially like workforce systems, which do involve sort of like huge amounts of like upskilling and training and like process redesign, is the provider going to be able to support you during that implementation, and what tools they have at their disposal. So Stuart, you mentioned there around sort of like self-learning. So one of the things that we've invested heavily in is how do we make sure that we consistently train hundreds, if not thousands of people in a way to be able to use like our technology and our platforms. So we've invested heavily sort of like in online learning modularization, which also has a little bit of gamification in there, probably not quite the same level as what you've sort of mentioned, but again, making that accessible and easy to use so people are engaged. And then also sort of by making sure that we sort of communicate directly to end users around when there are updates to our system and there is new sort of like features available to them as well. And we've done that in a really innovative way as well. And when you look at sort of like other systems, when there are updates, that maybe gets communicated to the original project team. That original project team have then got to deliver training, deliver sort of like new information. That's really costly, where actually what we do is we sort of just deliver that information directly to the end user, which saves the NHS and those project teams a lot of those ongoing costs as well. So again, I think it's just when people are sort of like looking at sort of like workforce platform systems, it's like how, or other sort of like technology systems as well, it's like how is the supplier helping you to deliver that ongoing piece? Because without it, that's when projects then sort of look to fail, or you get to the end of a contract and maybe hasn't quite delivered on some of those like benchmark pieces as well. So there's some pieces there. And then John, earlier on you sort of mentioned around sort of like ongoing like monitoring sort of like progresses as well, and I do think that's really important. So again, it's making sure that you have mechanisms in place to constantly review sort of what those benchmark targets would have been sort of like by implementing that technology, and making sure that it's okay to change or tweak a plan. And then Penny, I think you said earlier on, it's like okay to sort of like iterate sometimes and sort of like go back if something isn't quite working, understand why, because the cost of not changing is sometimes more costly than the change itself. And I think that's really, really important to sort of consider. So that benchmarking, regular feedback, and then sort of like iteration is definitely the key to sort of like monitoring progress and sort of ensuring like consistent delivery.
Penny, should I come to you next?
I couldn't agree more, Daniel. And I think that piece of evaluation and the continuous feedback process, it's not always done well, and it's so important. It's almost like this, almost like a pulse check of whether we are moving into the right direction, and if not, how can we refine that? How can we change our tactics? So I think that's really, really important.
Thank you, Penny. Sally, can I ask you a quick question about your maternity build, just to drill into that, because that was an interesting point. How did that work, and what went well there?
Yeah, so we actually, I mean, it did take quite a while for us to kind of baseline really. So we took a solution, a blueprint from our EPR supplier. that equated to roughly about 40 line items. And obviously, so for maternity, there's lots of national standards. There's the MSDS data set, saving babies' lives. We've got the CNST requirements. We'd got the Ockenden report at the time that came out, which we also had to implement into there. And the scale of the implementation from when we got the blueprint, the change that we had to implement in order for it to be fit for purpose for the organisation across the whole pathway, so antenatal, intrapartum, postnatal, and like for mum and baby, we actually went live with 160 line items. So it was what we were given by the supplier versus what we needed in order to go live safely was massively underestimated, really. And I mean, we have a digital midwife. We employed her specifically for that project at the time. And a lot of that work was working on the floor with the midwives and the consultants and the obstetricians to go through their processes, because it was fully paper. There was lots and lots of risk associated with the project, lots of risk associated with lots of different aspects of the delivery pathway. I'd probably say labour and delivery was probably the biggest eye-opener for me when we first started doing it. And I suppose, like, from a digital perspective, just obviously we want to remove like multiple kind of like processes, and we want to try and stop people from having to put the same thing in the EPR that's already been captured. So you can imagine at the point of like the intrapartum stage, when the mum gives birth to the baby has no NHS number. All of the details of baby are documented on mom's records, and we went through a whole stage of how do we extrapolate that information into a record just for baby without having to get the midwife to redocument that again. And they were spending about 4 hours writing up after the labour and delivery their notes, which obviously was instantaneous at the point of the episode. So they saved a lot of time. We did invite Bolton over because they had a request to come and have a look at our maternity solution, and we invited them over for the day. It took us a whole day to go through the end-to-end pathway, and even then we didn't show them everything. But I think one key thing that they really liked was that we created a bespoke development, which we call like the maternity tab, and in there it shows an overview of all of the information for mum and baby and any key kind of risks associated and management plans, if there are any alerts, allergies, any contraindications, as part of the whole pathway. It pulls it all into one view. So that was something that they'd never had before, and they really did like that. I think like, obviously when they went, it didn't take them very long at all really to ask us to take the build. But yeah, there was a lot of engagement. We had all of the midwifery team come from Bolton, all of their senior management team, and it was clear. I think it probably only took us then maybe 4 weeks to go through kind of like, what is it that you want? Like, let's just try and work out how can we like pull that from our system safely for you? Like, how can we make sure that when you implement it, that there are some things, because we've got the same EPR, that they just needed to assess from a risk perspective. So there were a few things that we had to kind of caveat, like you need to check all of these things before you actually load it into your environment, because we don't want to break anything existing in your own solution. But yeah, we've had really good feedback from them, and like they are very close with us now, even in terms of other developments. So I think like it's nice because you to formulate like relationships that are partnerships effectively, aren't they, really, as you move forward. And the more we can do that, you know, and the more that we can help each other, it saved them a lot of time. So yeah.
Fantastic. That's excellent. And we've got 2 or 3 minutes, so I'm going to try squeeze in another question. So Penny, can I come to you, please? What needs to happen in the next 1 to 3 years to accelerate change in terms of workforce transformation?
Yeah, I think for me is aligning a workforce strategy with a digital transformation strategy, really. So we talk about, you know, moving from analog to digital and from hospital to community and giving emphasis on prevention. Workforce needs to align with that strategy, and we need to understand, you know, who is the workforce, what roles actually we need the workforce to do, which roles are now redundant and we don't need those tasks to be done because technology has taken over, and how can we, you know, adapt the needs of the workforce as well to develop our workforce to be able to meet the needs of healthcare really moving forward. So very high level, but yeah, having a workforce strategy which is aligned with digital strategy, thinking about sustainability and workforce well-being.
Thank you, Penny. Very important point. And Dan, from your perspective?
Yeah, I was going to say, not trying to give away too many of our sort of like internal roadmaps or anything, but it's very much we can sort of see the direction of movement for like workforce outside of a single organization into sort of like the ICB ways of working as well. So some of the things is helping organizations find a safe and effective way to be able to deploy staff either substantively or sort of like on a temporary basis to multiple sort of like organizations, like through the way of like using digital passporting and relevant credentials. I think that's definitely like a really interesting space that we're looking to explore and support with our customer base. But I think the other thing as well is just it's transferring the way in which rotas are initially sort of like created and making sure that we're linking that back to true sort of like clinical demands as well. And it's almost sort of like moving away from we always have 4 people on this day, so we always need to make sure we staff 4 people on this day, to actually we only need to have 3 people because this is the activity that is running, to be able to sort of link some of that sort of like real-time sort of like patient information to know what we're staffing is safe and effective, sort of like based rather than just on previous thought.
Fantastic. Thank you, Dan. And it's just turned 1 o'clock, so we are up on time. So I'd like to say thank you to the panel for joining us. It's been a real practical session today, lots of learnings, and thank you for sharing your experiences. And as well, thank you to people for joining in the audience. I hope you found it useful. I'm sure you have. As I mentioned at the start, this session is recorded and there'll be a write-up so you can read or watch it back at a later date. So thanks again to the panel. A fantastic session today, and I'll look to close the webinar here. So thanks, everybody. Hope you have a nice day.
Bye now.
Thanks, everyone.
Thanks.
Cheers. Bye.
Thank you.